This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about standard precautions. From this session, you will have an understanding of the elements of standard precautions and how to use them in healthcare. Standard precautions refer to work practices that are applied to everyone, regardless of their perceived or confirmed infectious status, and are the minimum level of infection prevention and control. Standard precautions are used by healthcare workers to prevent or reduce the likelihood of transmission of infectious agents from one person or place to another, and to render and maintain objects and areas as free as possible from infectious agents. There are a number of strategies to prevent transmission of infection, and these will each be discussed. One of the most important elements of standard precautions is hand hygiene before and after every patient contact. Hand hygiene can be done by using soap and water or with the waterless alcohol-based hand rub. Alcohol-based hand rubs are convenient and are a good choice when your hands are not visibly soiled. The 5 moments for hand hygiene protect patients from acquiring organisms from the hands of healthcare workers and from the organism entering their bodies during procedures. Hand hygiene also protects healthcare workers and the healthcare surroundings from acquiring a patient's organisms. Another standard precaution strategy is the use of personal protective equipment when there is a risk of a body fluid exposure. PPE for standard precautions includes gloves, surgical masks, eyewear, aprons and gowns. The appropriate use of protective equipment when there is a risk of a body fluid exposure provides a high level of protection to healthcare workers. The safe use and disposal of sharps is another element of standard precautions. Sharps, such as scalpels and hollow bore needles, are necessary in healthcare but pose a significant risk of transmission of organisms if not handled or disposed of correctly. The person generating the sharp is responsible for the immediate safe disposal into an approved sharps container. Sharps must not be recapped, bent or broken after use, and overfilling sharps containers and passing sharps directly from hand to hand must be avoided. There are a number of safety sharps devices that have been developed with features that reduce the risk of injury from a sharp. These should be implemented and used where possible. Cleaning the environment is a key element of standard precautions. Routine structured cleaning with a pH neutral detergent removes organisms from the healthcare environment and reduces the risk of transmission from surfaces and equipment. Some surfaces require more frequent cleaning, such as those closest to the patient. However, all surfaces in the healthcare environment require regular cleaning. All organisations should have a documented cleaning schedule that outlines responsibilities for staff, including the duties and frequency of cleaning required and products to be used. All staff undertaking cleaning duties must be appropriately trained and provided ongoing education to ensure they are competent and supported in their role. Another element of standard precautions is the cleaning and reprocessing of shared patient equipment. Shared patient equipment can be implicated in the transmission of pathogens between patients and requires appropriate reprocessing according to its intended use and manufacturer's instructions. There are 3 categories of items in patient care, and each requires a different level of reprocessing according to the risk. Critical items are objects that enter sterile tissue or the vascular system and must be sterile. Semi-critical items come into contact with mucous membranes or non-intact skin and are preferably sterile or high-level disinfected. Non-critical items come into contact with intact skin but not mucous membranes and require thorough cleaning between uses. Some items are specifically intended for single use or single patient use. Items labelled single use or that have the symbol 2 in a circle with a line through it, such as a needle and syringe, must be discarded immediately after use. Single patient use items may be used repeatedly on a single patient and then discarded, such as a blood pressure cuff labelled single patient use. Respiratory hygiene and cough etiquette is another element of standard precautions and describes the techniques implemented to reduce the spread of respiratory pathogens. Respiratory hygiene and cough etiquette involves covering your nose and mouth with disposable single-use tissues when coughing, sneezing, wiping and blowing your nose. Use the tissues to contain the respiratory secretions and then dispose of the tissue directly into the nearest bin, cleaning your hands after. If you do not have a tissue available, cough or sneeze into your inner elbow or arm rather than your hand. Another component of standard precautions is using aseptic technique. Aseptic technique uses infection control measures to protect patients during invasive clinical procedures. That is, preventing pathogenic organisms in sufficient quantity to cause infection from being introduced to susceptible body sites by the hands of staff or from contact with surfaces or equipment. Waste and linen management is an important element of standard precautions. This includes the appropriate storage of clean linen and the safe disposal of used linen and waste. Clean linen must be stored in a clean, dry place that prevents contamination by aerosols, dust, and moisture, and be separate from used linen. Personal protective equipment must be worn when handling waste and used linen to prevent exposure to blood and body substances. Waste must be segregated at the point of generation into general or clinical waste streams. Waste regulations and definitions vary between jurisdictions. Therefore, it is important to understand the segregation requirements in your area. Linen must be placed into a laundry receptacle or bagged at the point of generation, taking care to avoid contact with staff clothing and in a manner that does not fluff the linen and disperse organisms into the environment. Hand hygiene must be performed after handling waste or used linen. Standard precautions refer to work practices that are applied to everyone, regardless of their perceived or confirmed infectious status, and are the minimum level of infection prevention and control. Standard precautions are used by healthcare workers to prevent or reduce the likelihood of transmission of organisms from one person or place to another, and to render and maintain objects and areas as free as possible from infectious agents. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control signs.